Hello, my name is Mrinalini Dey, and I am a clinical fellow at King's College London in the UK. I am in Vienna for Eular 2024, and today I'm delighted to share with you one of the abstracts which I actually saw yesterday. This is OP0156, which was part of the difficult to treat rheumatoid arthritis session. So the title of this abstract was Difficult to Treat Rheumatoid Arthritis in a Large Patient Registry, Validation and Prevalence. So if I just step back a little bit, taking this session as a whole, this was looking at difficult to treat rheumatoid arthritis. So there were several abstracts looking at various parts of this definition, which was brought out by Eular several years ago now. And as I was saying in the discussion for the live recap, if any of you caught that, this is actually a bit of a double-edged sword, because it's really great that we now have a definition within rheumatoid arthritis for difficult to treat disease. And this encompasses treatment failure, characterization of active disease, and clinical perception of the difficult to treat condition. But at the same time, this is actually one of the first studies to validate the definition in a large patient cohort. So this was done in the Brigham and Women's Rheumatoid Arthritis Sequential Study, the BRAS registry, and there were around 1,500 patients within this study, and they observed a prevalence of around 14 per 100 persons of difficult to treat rheumatoid arthritis. And they were basically applying that definition within their cohort. And actually, the definition was able to successfully identify the subset of rheumatoid arthritis patients who have not achieved low disease activity, despite having multiple biologics and targeted synthetic DMARDs. And actually, they found that compared to the non-difficult to treat rheumatoid arthritis patients, more of them happen to have a younger age, higher BMI, greater proportion of female gender, lower education levels, and more comorbidities. So all of the things maybe we may or may not expect. And actually, a lot of those factors came out in many of the other studies, which shows some consistency across cohorts as well. But one of the key conclusions of this study was that we really need to be, first of all, doing more validation studies in different cohorts, not just in these limited cohorts, but so that we can then apply and make sure that we are able to apply this particular definition in our observational studies going forward. The difficult to treat rheumatoid arthritis definition, as I started this presentation by saying, is a double-edged sword, because it's really great that we have it and it brings attention to difficult to treat disease, but also it's a very strict definition. You have to have the 3 different criteria in order to meet difficult to treat RA. So this was a really fascinating abstract for that reason, and it'll be really interesting to see what it shows when it's applied across various different cohorts. If you would like to hear more about this abstract or anything else at Eular 2024, do make sure you check out rheumnow.com. Thank you.